Assalamu alaikum. This is continuation of the cranial nerves that we were doing in neuroanatomy. Today we will discuss about glossopharyngeal nerve, which is the ninth cranial nerve. Learning outcomes include nuclei, course of the nerve, its branches, the structures it supply, and finally the lesions. Firstly, we come to the nuclei. The nucleus ambiguous is the brachiomotor nucleus and carries special visceral efferent fibers. It is located in the reticular formation of the medulla oblongata and is formed by superior and is also known as main motor nucleus of glossopharyngeal nerve. Second is the inferior salivatory nucleus. It is the parasympathetic nucleus and carry general visceral efferent fibers, and it is present in the lower part of the pons. The third and last nucleus is the nucleus tractus solitarius, or it is also known as the nucleus of solitary tract. It carries general visceral efferent and special visceral efferent fibers. Here you can see the allocation of all the three nuclei. This is the superior salivatory nucleus present in the pons. This is the nucleus tractus solitarius that is present here, and this is the nucleus ambiguous that is present here. The nerve arises from the rostral part of the medulla, passes anterolaterally through triangular depression of aqueduct of cochlea on the inferior surface of the petrous temporal bone. It is separated from 3rd and 11th cranial nerves by inferior petrosal sinus. Here you can see the location of the glossopharyngeal nerve. This is the glossopharyngeal nerve present in the petrous part of the temporal bone, passing through the jugular foramen. As we have already discussed that it is separated from 10th and 11th cranial nerve by inferior petrosal sinus. Then by passing through this foramen, the nerve has two ganglia that are known as the superior and inferior glossopharyngeal sensory ganglia that are situated just at the level of the jugular foramen. The nerve then descends through the upper part of the neck and accompany the internal jugular vein and internal carotid artery, and it reaches the posterior border of the stylopharyngeus muscle, which it supplies. The nerve then passes forward between the internal jugular vein and internal carotid artery. It also supplies the carotid sinus as well. Now, this was a brief course of the nerve. Now we will discuss about its ganglia. There are superior and inferior ganglia of the glossopharyngeal nerve. The superior ganglion is situated on the upper part of the groove of jugular foramen. This ganglion is small and it do not give any branch, and it is mostly known as it has been detached from the inferior ganglion. The inferior ganglion is present in the lower border of the petrous temporal bone. It is larger and its branches convey taste and tactile signals from the mucosa of the tongue and general sensations from the oropharynx. Now we come Now we come to the branches of the glossopharyngeal nerve. Glossopharyngeal nerve give communicating and distributing branches. The communicating branch basically connect vagus, facial, and the sympathetic trunk. In the figure below, the connections are shown. Then is the here you can see the tympanic branch and how it forms tympanic plexus in the middle ear. Then we come to its carotid branch. It arises just below the jugular foramen, descend on internal carotid artery to reach the carotid body and sinus. It communicates with the vagus and sympathetic branches from the superior cervical sympathetic ganglion and supplies the carotid body. Then we come to its pharyngeal branches. Here is the pharyngeal branch. Three or four filaments which unite near the middle constrictor muscle with the pharyngeal branches of the vagus and sympathetic plexus to form the pharyngeal plexus. The branches from these plexes perforate the muscular coat of the pharynx and supplies its muscles and mucous membrane. The muscular branches of this nerve go to the stylopharyngeus. This muscle elevates the pharynx in case of gagging and swallowing. Then we come to its tonsillar branch. This is again a very good picture of the schematic diagram and course of the glossopharyngeal nerve. Here is the tonsillar branch. The tonsillar branch joins with the lesser palatine nerve and forms the plexus. The plexus supply the tonsils, soft palate, and palatoglossal arches. Then is the lingual branch or the lingual nerve. It supplies the circumvallate papillae, mucosa near the sulcus terminalis, and mucosa of the posterior part of the tongue in communication with the lingual nerve. By this, we come to the end of the course of the glossopharyngeal nerve. Now we come to the lesions of the glossopharyngeal nerve. First is the gag reflex, that is very important to check the functioning of the nerve. It is possible to touch the anterior part of the tongue without feeling discomfort. When the posterior part of the tongue is touched, the following nerves are responsible for this reflex, that are the ninth, 10th, are responsible for the muscular contractions of each side of the pharynx. So the gag reflex is brought about. Because ninth, 10th and 11th pass through the jugular foramen. Next is the next we come to the second lesion, that is the gag reflex is not a lesion, it is a normal functioning of the nerves that are basically the ninth and 10th nerves. The second is the superior jugular bulb thrombosis. This is mostly caused by the otitis media. Then we come to the jugular foramen syndrome. Because ninth, 10th and 11th cranial nerves, they pass through the jugular foramen. In case of tumors that can give pressure, that can exert pressure on the nerves. So this type of uh, pressure that affect all the nerves is known as the jugular foramen syndrome. By this we come to the end of our glossopharyngeal nerve. Thank you for your attention. Allah Hafiz.